You have a project called the Omega Bed Program, the Arches Program, and Alpha. But I'd like for our audience to sort of understand a little bit about each of those, because I think they're each different, but collectively all involve sort of a similar broad goal, but are trying to develop partnerships within the community to address this issue, right?
Yeah, so when we, as I mentioned, in 2015, we really took a deeper dive into data, and what we identified is that we had over 4,100 what we would call avoidable days. So stays in the hospital that a person has surpassed the time ready for discharge. And when we considered those 4,100 days, there was a couple of ahas that we had. One, if we didn't have those days, how many community members could we have served for critical care needs? And that's always a strong focus for us. When we delved deeper into that data, we found that 3 buckets of opportunity. The first was 40% of the patients needed to go to a nursing home, but we had barriers in our ability to get them there timely and efficient. Some of it had to do with the burden of care that the nursing homes needed to be able to provide. Others had to do with the court system and the medical assistance application process, which in our communities delayed the ability to get patients there timely. And so our strategy for that was to partner with a community nursing home, so Pleasant Acres in our community. And we developed a bed lease program that allows us to more efficiently advance patients into that level of care outside of those state and stated barriers in terms of guardianship and medical assistance application, and even address the care burden issues in a collaborative way with our nursing home. So that was the first 40%. The second population we identified was that 20% of the patients had insecure housing and did not have a housing arrangement after their hospital stay that could meet their needs. So this is everyone from a person who's homeless to an individual who may live on a 3rd floor apartment but has a fracture, a pelvic fracture, for example, and can't go up and down steps every day. And so we then, with that program, we partnered with a community personal care home for a low-income personal care home to develop the Arches program. And it's an Arches program for recuperative care. Recuperative care programs are nationally known and address that population of insecure housing, where you bring medical care and some social support into a setting. In our case, we chose a low-income personal care home to provide support and services. We target about 45 days for patients in that program. Our Mega Bed program, I didn't mention, but it's a 90-day program is our target for that before they would move into another setting. And then the last 40% of that population, we recognized a community infrastructure that was needed. That was beyond the hospital and the health system alone. And so for that, we recognized that we really needed to seek out a partner in the community to take the lead on that. And we're fortunate that the York Housing Group in the York community was willing to take on that leadership. And it really has to do with a statewide issue around the lack of affordable low-income personal care home and the loss of that in our community in the past 10 years and what that means. And so particularly in our South Central Pennsylvania areas, we have low income of nursing or low numbers of nursing home beds, as well as low numbers of low income personal care home. And the combination of that really puts a taxing support in hospitals and healthcare. And so that's part of why we recognize WellSpan's need to be very engaged in the work, but also recognize the need that we can't lead it all. And so we need to rely on our community partners to help us do that.
Yeah. Oh, go ahead.
In each of those programs, there was pretty significant community engagement in the planning. So for instance, when we looked at building the Arches to Wellness program, we had a community group of about 12 different individuals representing different organizations come to the table to help us complete a needs assessment. This isn't something you'd want to rush into. We wanted to look at what's the need, what does the need look like? How many people? Is it males? Is it females? How long do they need to stay? What type of medical care are they going to require? Are there individuals that wouldn't be appropriate for the program? So we were able, there's some resources out there nationally that really help to support this, but I would say, the community needed to own the process, to be able to buy into it and to be able to say, yes, we can do it here. One of the aha moments came for us when we realized that we only had one accessible shelter bed in the county. So in some areas, they use shelters to support the medical respite or the recuperative care programs. In our community, that wasn't an option. One of the nice things that came out of this is, Ann mentioned, we actually used the Arches to Wellness program in a low-income personal care home, which actually brings together the Alpha program and the Arches program, because by locating that Arches to Wellness program in a personal care home that supports low-income people on the upper 2 floors, we're able to contribute to the sustainability of that facility. And so it's a win-win in different programs. And I think the better you integrate community resources, the more you understand what's available, the less you duplicate services, and I think it just opens up wider opportunities.
Yeah, so very interesting. And I know, Dianna, you've been heavily involved in trying to bring together and work with these community groups, as well as at the state level from a policy perspective. So maybe some of your thoughts on that, I guess, as I understand the issue, if you think about it broadly, I think, as Ann said, there's a piece of this that really multiple sort of individuals or entities kind of need to own it. Yes, it is the healthcare system, but it's also state government who supports housing and housing authorities and, sort of interacts with the federal housing and urban development authority. We have the state Medicaid program who pays for medical assistance in healthcare for many individuals. Of course, we can think about community redevelopment and tax revenue and the value of, sort of redeveloping dilapidated buildings or to, sort of getting housing up to speed for an elderly population. So there's lots of pieces to this, right? And maybe some lessons that you've learned, both positive and maybe what's been frustrating at trying to get these various parties to work together, because I imagine that because it's everybody's problem, it's easy for any one person to say, well, you know what, we can only do so much. But unless you can bring people together and get them to cooperate and sort of own this collectively, we're probably never going to fully address this issue.
Well, I think, it's a challenge for somebody trying to coordinate this and really engage people and create that passion around any kind of topic. And so it's to do that without a facilitator, I think, is very difficult. You need somebody who can sort of be the pivot point on that and can actively continue to reach out and engage. We did the work through developing action teams on the Alpha project. And so we had different action teams that individuals could participate in depending on their interest and their skill set. And those action teams then worked on a set of goals and objectives to be able to support the low-income personal care homes in our community. So for instance, there's an action team around behavioral health, and there's an action team around advocacy. And so each of these action teams then worked somewhat independently, but come together as a group then to work as a collective on a quarterly basis. There's about 70 individuals, I think, working on Alpha and at least 30 different organizations. And right now we're expanding the advocacy. So in addition to the people who are doing the sort of on the ground work, we are also bringing organizations and statewide entities together to support the advocacy initiative around increasing the payment rate to these low-income homes. I think one of the things that's important is to remember that we're advocating for a group of people who doesn't self-advocate. Right. These are not people who are going to have a loud voice, and we have to create that voice for them. And that really is part of the advocacy effort around Alpha.
Yeah, I would add that, some of the things, the startling, information that we shared and have been making visible. And I think it's really important, as Dianna said, this isn't a group that is able to voice their concerns or their issues. But when you look at York County, for example, we have 60 beds for low-income personal care home. in our community. And yet, if you look at the current data, we have over 11,000 individuals over the age of 65 who are at or below 150% of poverty. That in and of itself does not add up. It's not good math. And so being able to make that visible to our community leaders and to our legislators, and to talk about that. Low-income personal care home essentially is $36 a day. And $36 a day, you can't even board your dog for $36 a day without bringing your own food and your own medications. And yet these low-income personal care homes are trying to do just that. And they don't have support for food, and they don't have support oftentimes for the medications that their clients need. And so being able to make those numbers and the visibility of those issues is really important, and is a big part of the work we've been doing.
Right. And by bringing different entities together, it's really broad-based. So we may have one organization that says, hey, I can coordinate advertising in this publication. This is the forms we need to use. And so we can do some marketing at no cost. And another group says, there's issues around medication, and I think I have some solutions for that. So let me work with a small group to help develop a plan that would offset some of the medication copay costs that are creating some challenges. And so by using these different entities, they bring resources to the table. And to have a skillful community process, you need to have multiple entities at the table that have that maybe don't think like I do or like Ann does, but bring a whole different perspective to the process.
And I would add that I think one of the things that Penn State has brought to the table for us has been some research in this area, looking at it nationally, and as well as helping us to articulate the approach. And so one of the big things I think we've gained from this is as we started to tackle one issue, and that one issue has many different facets to it, it really has helped to raise the need to be a connector for other issues. So I'll use the example of Alpha and the Arches program. If you looked at some of the work we did over the course of this past year in terms of stepping stones, what you'd see is we started off addressing the need for our Arches program of having a place to bring medical care together with some social support. But what it also did was help us to realize the connections this population needs to work already being done in our community. So for example, WellSpan has some programs around low-cost medications. It's called Prescription for Caring. Well, this population meets all of the requirements for prescriptions for caring, but none of this population is in that program. And so it helped us realize, well, we need to get prescriptions for caring connected to this group of patients. We started to see that many of the patients or the community members in the Arches program were starting to see their blood sugars elevate. And when you took a step back and looked at the type of food that the personal care home can afford to buy with $36 a day, they needed access to fresh food. And we have some community initiatives around fresh food going on. And so how do we connect those services to our patients and our community members? And so these programs really has served to help us better connect some of the work already in the community in a better way. And so I think, and that really has stemmed from some of the research that Penn State has done, some of the work you've done in sort of pulling together a documentation of that. It really has helped us to realize that some of it is we just need to connect.